Stress and anxiety are two words we often hear and feel, but they're not the same thing. While stress is usually tied to specific external pressures and tends to go away once the situation is resolved, anxiety runs deeper, creating persistent feelings of fear and unease even without a clear cause. Understanding the key differences between stress and anxiety is crucial for managing your mental health effectively. Let's dive into how they differ, why it matters, and how you can better navigate both. Today, we will talk about anxiety versus stress. What's the difference? Understanding the basics, defining stress and anxiety. In everyday conversation, people often use the terms stress and anxiety interchangeably, but in reality, they represent distinct psychological states with unique causes, symptoms, and implications for mental and physical health. Stress is generally a response to an external cause such as tight deadlines, financial difficulties, relationship problems, or major life changes. It usually subsides once the situation is resolved. Stress is a natural and sometimes beneficial reaction that can motivate us to meet challenges and perform under pressure. Anxiety, however, is more internalized. It is characterized by a persistent feeling of apprehension or dread that doesn't go away even in the absence of an immediate threat. While stress is typically tied to a specific situation and has a clear endpoint, anxiety can persist indefinitely and often seems disconnected from any clear cause. Anxiety disorders, in particular, represent a range of mental health conditions that require professional attention. Understanding these basic distinctions between stress and anxiety is crucial for identifying them accurately and managing them effectively. The physical manifestations, how stress and anxiety affect the body. Both stress and anxiety have significant impacts on the body, although the mechanisms and patterns can differ. When the body encounters a stressor, it activates the sympathetic nervous system, often called the fight or flight response. This results in a cascade of physiological changes. The heart rate increases, breathing becomes rapid, muscles tense, and blood pressure rises. These reactions prepare the body to confront or escape a perceived threat. While helpful in short bursts, chronic stress keeps the body in a constant state of heightened alertness, leading to problems like hypertension, digestive issues, weakened immune function, and even heart disease. Anxiety, although it shares many of these physical symptoms, such as rapid heartbeat, sweating, trembling, and shortness of breath, tends to involve prolonged and disproportionate physiological arousal even without a direct threat. Over time, chronic anxiety can lead to complications like insomnia, headaches, gastrointestinal disorders, and chronic fatigue. Moreover, anxiety can cause individuals to become hyperaware of their bodily sensations, sometimes misinterpreting normal bodily functions as signs of severe illness, further exacerbating their emotional distress. The psychological differences, emotions, and thought patterns. Psychologically, stress and anxiety exhibit distinct patterns of thought and emotion, though overlaps certainly exist. Stress often involves feeling overwhelmed, frustrated, or pressured due to external demands. It tends to be task-oriented and focuses the mind on specific problems that need resolution. A stressed individual might think, "I have to finish this project by tomorrow," or "I need to pay these bills before the deadline." The emotional landscape of stress is often situational and transient. Anxiety, on the other hand, is more pervasive and internal. It's marked by excessive, often irrational worry about future events, even when there is no immediate danger. An anxious person might think, "What if I fail even after trying?" Or "Something bad could happen at any moment." Anxiety creates a persistent sense of unease and dread that can infiltrate every aspect of life, leading to avoidance behaviors, difficulty concentrating, and irrational fears. Unlike stress, which usually subsides after the stressor is eliminated, anxiety can continue indefinitely, feeding on imagined threats and internal fears. Causes and triggers. External versus internal origins. Another key difference between stress and anxiety lies in their causes. Stress is almost always a reaction to an external event or circumstance. Common stressors include work deadlines, school exams, major life changes like moving or divorce, financial difficulties, and conflicts in personal relationships. These external pressures create a sense of urgency or threat that drives the stress response. Anxiety, while it can be triggered by external events, often arises from internal processes, including cognitive distortions and predispositions toward worry. It may stem from past traumas, unresolved emotional issues, genetic factors, or imbalances in brain chemistry, such as deficiencies in neurotransmitters like serotonin and dopamine. Certain personality traits, such as perfectionism, neuroticism, and a tendency toward rumination, also make individuals more vulnerable to developing anxiety. Furthermore, while a stressful situation may induce temporary anxiety, clinical anxiety disorders such as generalized anxiety disorder, panic disorder, and social anxiety disorder exist independently of specific external stressors and often require long-term management strategies. Impact on daily life, functionality, and coping mechanisms. Both stress and anxiety can significantly impact daily functioning, but they do so in different ways. Short-term stress can actually enhance performance in certain situations by increasing alertness and motivation. For instance, a moderate amount of stress before a big presentation can sharpen focus and drive preparation. However, chronic stress can lead to burnout, characterized by emotional exhaustion, cynicism, and decreased productivity. People dealing with chronic stress may withdraw socially, neglect self-care, or engage in unhealthy coping mechanisms like overeating, smoking, or excessive alcohol consumption. Anxiety, particularly when it reaches a clinical level, often impairs daily functioning more severely. Persistent anxiety can make it difficult to concentrate, sleep, interact socially, or engage in everyday activities. Anxiety disorders can lead to avoidance of feared situations, resulting in social isolation, job loss, academic difficulties, and overall diminished quality of life. Effective coping mechanisms differ for stress and anxiety, but generally include healthy lifestyle habits, mindfulness practices, cognitive restructuring, and, when necessary, professional intervention. Biological underpinnings. How the brain responds. The biological processes underlying stress and anxiety also show important differences. Stress primarily activates the hypothalamic pituitary adrenal (HPA) axis, leading to the release of cortisol, the body's main stress hormone. While cortisol is vital for survival, chronic overproduction due to prolonged stress can impair immune function, damage brain structures like the hippocampus, important for memory, and contribute to numerous physical illnesses. Anxiety, while also involving the HPA axis, is more closely linked to dysfunctions in the amygdala and prefrontal cortex. The amygdala, responsible for detecting threats and triggering fear responses, becomes hyperactive in individuals with anxiety disorders, perceiving danger even in safe environments. Meanwhile, the prefrontal cortex, which helps regulate emotional responses and implement rational thought, may be underactive or inefficient, making it harder for anxious individuals to dismiss irrational fears. Neurotransmitters like GABA, gamma-aminobutyric acid, also play a significant role. Low levels of GABA are associated with heightened anxiety. Understanding these biological differences is crucial for developing targeted treatments, whether through medication, therapy, or lifestyle changes. Treatment approaches: stress management versus anxiety management. Although stress and anxiety often require overlapping treatment strategies, key differences exist in their management approaches. Stress management focuses heavily on reducing external pressures and enhancing coping skills. Techniques like time management, prioritization, relaxation exercises such as progressive muscle relaxation, and developing a strong social support system are effective tools. Mindfulness-based stress reduction (MBSR) programs have also shown tremendous success in helping individuals reduce their stress levels through meditation, body awareness, and yoga practices. Anxiety management, particularly for clinical disorders, often requires more intensive psychological interventions, such as cognitive behavioral therapy (CBT), exposure therapy, or acceptance and commitment therapy (ACT). CBT helps individuals identify and challenge irrational thought patterns contributing to anxiety, while exposure therapy gradually desensitizes them to feared situations. Medication may also be prescribed for anxiety disorders, including selective serotonin reuptake inhibitors (SSRIs), benzodiazepines, or beta blockers. Lifestyle factors such as regular exercise, a nutritious diet, and sufficient sleep are beneficial for both stress and anxiety, but individuals with anxiety disorders often need longer-term support and monitoring.